MAHA comes for vaccines. This is America Dissected. I'm your host, Dr. Abdul and Katelyn.
And I'm your co-host, Dr. Katelyn.
And we're taping this on Friday, June 27th at 11 a.m. Eastern Time. And here we go. So, Katelyn, just quick vibe check for us. How's your aura?
I don't know, man. This week, ACIP, I know we're going to get into it. Like, completely, I don't know. Every day it's different. Like, one day I find hope, and then another day it's just completely bogged down. I don't know. How are you feeling, Abdul?
Yeah. I mean, look, the hard part about it is this is kind of like watching a movie that you know is a horror movie, but like the whole setup to the beginning of the horror movie is getting you to like the main characters. And then you know in the end, there's going to be screams. One of them is going to die.
Killed. Yeah, killed.
Right? It's like, it's going to be bad news. But like at the beginning of the movie, you kid yourself into thinking that like, this is just another rom-com, except for, you know, somebody's going to die. So anyway, all of that is to say that I feel like we're now in the like end part of the horror show that we all kind of knew we were getting into when we sat down in those seats and started eating popcorn. And like, here we are, this is that part. So the other part of it though, is the reminder that once the horror scenes are done, like there is an end to this. And I just think sometimes we make two mistakes: to have thought that it wasn't coming. And then the second is not to remember that actually history doesn't end after they try and gut all of the vaccine infrastructure. And I just try and remind myself both of those things.
Yeah, I agree. I think the biggest question is like, we're going to have to do this for another 3.5 years or even longer. Like, I mean, you're right. There's these dark periods that happen, and this is, not individualized to just this moment. And what we do see is periods of enlightenment after periods of dark, but like sometimes those periods of dark are really long. So I guess I'm just trying to figure out how to make this a marathon, not a sprint, how not to get burned out, how to ground myself in values. It's just a really disorienting time, and hard to find. I think I've said before, I just feel like it's a magnetic storm.
Yeah. Well, let's get into it. And I appreciate everybody waiting an extra day for the pod, because we wanted to tell you what happened at this week's much awaited, much feared Advisory Committee on Immunization Practices, or ACIP meeting. Let's start by explaining what all of this is. So the Advisory Committee on Immunization Practices is the committee at the CDC that determines vaccine policy recommendations in the US. So they don't set policy per se, but they make the key recommendations off of which insurance companies and local and state health departments tend to base their recommendations and requirements. That's everything from what vaccines to recommend and also what schedules on which to recommend them. They meet usually a few times a year, and their June meeting is especially important because, of course, that is the meeting that sets the standard for cold, flu, and COVID seasons. And this is how insurers make decisions about coverage on vaccines. So this is a really, really important one. And then, of course, as context, we've covered this quite a bit on the show, but RFK Jr. recently ousted all 17 members of the committee in basically a public health version of a coup to replace them with his own people. He named 8 folks. One of them decided to voluntarily step out. And so the 7 people now on the committee, which, by the way, does not hold quorum, which is an issue, include 4 who have expressed skepticism about vaccines, 2 that are just basically unknown to folks like Katelyn and I, and not well known in this sort of sphere. They're not renowned policy experts, as you would imagine, befitting a place on this really important committee. And then lastly, one appointee has been on ACIP before and is widely considered the most qualified member of the team. So in broad strokes, Katelyn, give us a sense of how we should be thinking about ACIP now, post RFK coup, versus before, pre-RFK coup.
How should we be thinking about it? I mean, I think that's the ultimate question right now. And what we are trying to determine this past week is like, what does this look like? Because there's such huge implications for ACIP. It's, how you determine insurance coverage and who gets vaccines when, and Medicaid coverage for vaccines and access and reach and campaigns and communication and all of it. And if we have a vaccine committee that has several members with little or no vaccine experience, several members that are anti-vaccine advocates and have gotten a ton of money from vaccine litigation trials, as well as these media empires rooted in sowing doubt. I don't know how we use this. And I think that's the ultimate question is, do we need to create a shadow ACIP? How do we get the broader health ecosystem all united with one voice so Americans ultimately know what the hell is going on and what they're going to have access to and what is true and what is false information, which is creating this incredibly confusing storm. And so that is the question, is what are the implications for this, and what, I think even more importantly, are we going to do about it, not only for this fall season, which is coming up quickly in about 2 to 3 months, but also routine childhood vaccinations, which they keep signaling is coming down the pipeline. So we'll see, but it's really, really concerning. This is huge implications.
Yeah. And, the meeting itself was called into question by the chair of the Senate Help Committee, Senator Bill Cassidy, who, of course, voted for RFK Jr., knowing what might have happened. He wrote, quote, "Although the appointees to ACIP have scientific credentials, many do not have significant experience studying microbiology, epidemiology, or immunology. Some lack experience studying new technologies such as mRNA vaccines and may even have a preconceived bias against them." Oh my God, may even have a preconceived bias against them, much like RFK Jr., who you voted for to confirm. Of course,
way too late. It's way too late for this.
But like, this is the thing about it, is like, what did you think was going to happen when you invited the arsonist to the house? Like, it's as if we didn't think that all of this was, it's like all of us kind of, to the point about this metaphor of the horror show, all of us kind of knew that this was going to happen. And he's like, well, let's go see the show anyway. I know you all don't want to watch this, but like, let's see what happens. And now he's coming midway through the show and be like, who knew people died in this? That's crazy.
Why do you think, Abdul, he came out saying that the night before? You think it's like a political move just to say, I don't agree with this, but I know nothing can happen. I just want to save my ass? Or do you think that he was, in the past week or two, once those ACIP members were handpicked, trying to work in the background to really get new members on or get it changed, and then ultimately he wasn't successful, and so he kind of dropped this nuke? I mean, I'm trying to figure out what his play was here.
I think there's a couple things. I think one of them is that he wants to distance himself from what is happening. A. I think B, all of this is happening in the broader context of the big ugly bill in which they're trying to gut Medicaid. And I think he is engaging in this way to send warning shots across the bow in terms of the negotiation there. And then don't forget, like, history doesn't end with this meeting. There's still more out there.
Yeah.
And I think he's trying to send a warning shot about how far this new, ACIP minus goes in terms of other chits that he has to deal with RFK Jr. And so I think he's trying to set himself up on other negotiations. And this is the thing about Cassidy, is that he's a man torn. I mean, this is a guy who signed on to the MAGA agenda, but also he, up until he went into politics, was a practicing physician. He knows better. Yeah. And he knows that a lot of the things that RFK Jr. is doing is anti-science and frankly not based in any sort of sense of reality. And so now he's caught up. There's the side, there's the devil on his one shoulder that is the MAGA folks, and then there's the angel on the other shoulder that's, everything he knows about science. And I think you're seeing a man who's like torn between the two of these, trying to negotiate something so that he's not attacked by MAHA or MAGA, and also trying to protect what he knows to be completely, fact-oriented, evidence-based policymaking.
Drives me insane.
It is. So anyway, in the end, they did meet, and they announced a number of new working groups, which I think are really important because they're outlining here what it is that they're going after. One is the U.S. vaccine schedule. The other is vaccines that have not been reviewed in more than 7 years, as if basic physiology has changed in 7 years. And this idea of cumulative impacts of the different vaccines that are given to children and adolescents. And just to explain this idea here, what they're saying is any one of these vaccines may be healthy, but once you put all of them together, maybe there's this emergent property of all of them together that could be dangerous. It really looks like they're looking for something that, if you just step back for a second, you kind of have to say, well, what's the broad consequence of all these vaccines? I don't know. Kids aren't dying of vaccine preventable diseases on net, but they want to look into this. So when you go hunting for something, right, that tells you what you want to find. And so they have a real shot, I think. And so they're telling us where they're going to go. There's also a really long discussion about thimerosal. So Katelyn, can we talk a little bit about first some of these working groups and what this tells us about where they're headed? And then we could talk about thimerosal.
Right. I think both of them are connected, though. And I'll tell you why. So I was a poor soul and watched both of these meetings for the past 2 days. And, this meeting was mostly about fall vaccines, rightfully so, right? Respiratory, RSV, flu, COVID-19. And one of these discussions about flu was about thimerosal. Now, fine, have a working group that looks at thimerosal, have a working group that looks at the vaccine schedule and hepatitis B and whatever. However, the biggest flag we saw yesterday in this ACIP meeting was this thimerosal conversation made it very clear that this committee had already come to a conclusion and then sought evidence to support it. And this is called policy-based evidence making rather than evidence-based policy making. And that's really, really concerning. So thimerosal, for everyone who's listening, is a preservative we've put in vaccines. It's used globally in multiple vaccines. In the United States, it's only used in a small amount of flu vaccines. And a lot of evidence has shown that it doesn't do any harm at the dose that we receive it. It doesn't even do cumulative harm. However, what we saw yesterday at ACIP meeting was this lady, her name is Lynn Redwood, and she is a former leader of the Children's Health Defense, which is this anti-vax advocacy group. And she was invited to present data as a layman, to present data presentation. In short, her presentation absolutely flooded the zone with cherry-picked data that was just taken out of context. Also had fake citations, likely due to AI. And this is really what made me concerned, and it'll bring me back to these routine vaccinations, is that external presentations like this one are typically fact-checked by CDC. That is the process. And this occurs days or weeks in advance of ACIP meetings by these work groups to ensure that we're, grounded in evidence and facts. That didn't happen this time. None of the CDC employees or the work group saw this presentation ahead of time, maybe a day before, certainly wasn't vetted. And so, fine, thimerosal, take that out of our supply, right? That's only 4 to 7% of our flu vaccines. It's really not going to impact much in availability and accessibility of flu vaccines, fine. But what I'm concerned about is that it is laying the ground of processes and expectations of these work groups that are then going to start coming after vaccine schedule. It is going to keep coming after specific vaccines like MMR or hepatitis B or HPV. And so, yeah, I mean, I don't know what else to say, but I'm very concerned about how these processes played out in the past few days and what it's going to mean for future ACIP meetings.
Yeah. And Katelyn, I think the broad point here that you're hitting on is that you want a body that comes to the evidence by virtue of a perspective founded in the goal simply to improve people's health. And it is unbecoming when you know that there is an internet-based conspiracy theory and somebody whose job it has been to pump it, who gets access to a group and then shapes the outcomes of a vote of that group, right? Because after that presentation that likely was written by AI, they voted not to allow shots containing that specific preservative, thimerosal. And so you got to ask, all right, was this all like kabuki theater so that they made the show of showing this evidence and then the cherry-picked group of 7 down from 17 then votes in this particular direction? And so you want a process that you know is not driven by somebody's preconceived ideological notions. Let's cover a little bit more about what some of the other votes that they took. Katelyn, can you walk us through some of those?
Yeah, so overall, like I said, this was mostly about fall vaccines. There were some votes around RSV. We're going to have in the committee voted not unanimously, which is interesting, for a new RSV monoclonal antibody for infants. And I think that this is good news because it increased choices and access, although there were so many falsehoods just talked about during this vote of having a monoclonal antibody. They voted against, like we said, thimerosal and flu vaccines. And that's about it. I think noteworthy is they did not vote on anything about COVID-19, which is highly unusual and highly unhelpful for those of us that need to order vaccines, like physicians in July that need to understand who's eligible when and where and fall. So still a ton of unanswered questions.
And Katelyn, so just stepping back for a second, thinking about the context here, I think a lot of us were worried that this was going to be an expo of some of the worst mis and disinformation that you've seen around the internet now done at an ACIP meeting. What actually ended up being the case here?
Right. So the meeting, one showed really high competence of CDC employees, right? They were thorough, they were thoughtful, they were well prepared in their presentations. The committee, though, we ended up watching it in real time and like tallying how many falsehoods were said and trying to counter in real time. And we counted up more than 50 falsehoods, all the way from questioning, basic epidemiological methods to straight up conspiracy theories. It's just going to make it for a very confusing landscape for the public going forward, trying to understand what is real and what's not real. Because if you just tune in and listen to this, it sounds good. It sounds legit. It looks legit, but that's missing the entire point. And so we need to figure out how to navigate this. All right, Abdul. How has this meeting been received in the public? Even, among folks in the public health community.
I think the sad truth is a lot of the public's not really paying attention. This feels very process oriented. And that's what science is, which, as you well know and I know, makes it really, really difficult to explain. But a lot of folks that people trust in the public, so you got like the American Academy of Pediatrics boycotted the meeting. And they said, I quote, "We won't lend our name or our expertise to a system that is being politicized at the expense of children's health." The AMA and nearly 80 other professional organizations, they issued a joint statement saying that they're going to continue to follow and promote evidence-based vaccine recommendations. The folks who represent health plans and health insurers, they affirmed a commitment to a fall vaccine, and they want to make sure that patients aren't left with unexpected costs because of these changes. And then, of course, there has been a real push among Democrats in Congress to call out what RFK is doing. In fact, you had Kim Schrier, who's a physician and a Democratic congresswoman. Here's what she had to say.
You lied to Senator Cassidy. You have lied to the American people. You have lied to parents about vaccines for 20 years. And I also want to be clear that I will lay all responsibility for every death from a vaccine-preventable illness at your feet. I yield back.
And all of this is in context of the fact that the American public supports vaccines. Like this isn't something that the public has been calling for. It's a small group of mis and disinformation pushers who have been pushing all of this and have somehow risen to the top of American public health policymaking. In fact, a recent poll from Harvard and the Beaumont Foundation, they found that 79%, so nearly 4 in 8 U.S. adults, say children should be vaccinated against vaccine-preventable diseases like measles, mumps, and rubella in order to attend school. And it's really hard, if you haven't noticed, to get like 80% of all of us to agree on almost anything. And that includes, by the way, 68% of Republicans. So talking about 70% of Republicans. So this is not a clamoring for a rethinking. It is a very particular ideologically driven effort. And so coming out of this, Katelyn, what are your big takeaways, as a mom, as an epidemiologist, about how we need to be thinking about access to vaccines in the future?
Like I said earlier, I think that the health if I put my health leader hat on, we can't rely on the federal government right now around access and information and clarity and process. And so the entire health ecosystem, from insurers and payers to physician groups to health systems, I mean, really need to have courage, really need to step up in a united voice and get to work to make this clear so Americans actually know what the hell is going on. As a mom, I'm incredibly concerned. Both my girls are fully up to vaccines, but if they take away HPV vaccines and my girls can't get it in a few years, I'm going to be livid if I'm not already livid right now. So we'll see where this goes.
That's the thing. You have to remember, like these things affect all of us in our everyday lives. And where I think a lot of the biggest impact of the RFK Jr. driven jihad against vaccines is going to have its biggest impact is going to be internationally. In fact, there was a huge meeting of an organization called GAVI, and they hold every 5-year fundraising summit. GAVI, of course, is an organization whose big goal it is to vaccinate folks in some of the lowest income parts of the world. And in the middle of that meeting, RFK Jr. Had a pre-taped video basically accusing GAVI of ignoring vaccine safety issues, again, of course, without any evidence. As we think about this, right, what that means for folks, in places like Sub-Saharan Africa, in places in Southeast Asia, that means that you're going to have a lot of kids who are going to go without vaccines who otherwise would have gotten them and would have lived from diseases that they otherwise will die of. And, we take for granted that vaccines have been so effective in countries like the one we live in that you don't really have that much risk, at least not yet, of getting these diseases. But in a lot of places, that's not true. And so you're talking about folks who may go without these vaccines and may die, and all because of this hype about the risk of vaccines, when in places like that, these folks cannot ignore the risks of the diseases that vaccines are intended to protect you from.
Yeah, it's clearly just the next stage of RFK Jr.'s like global anti-vaccine crusade, honestly. Like you said, GAVI, they have vaccinated over 1 billion children and help vaccinate right now half of the world's children. It is one of the most successful public health collaborations in history. And I think we need to, really think why GAVI was even needed in the first place, right? It's because there's not really a, quote unquote desirable market for low and middle income countries for vaccines. And so what GAVI does is fills in this market failure by buying vaccines in bulk, and taking that funding away based on falsehoods, not even based on efficiency or saving money or whatever we've heard of the past couple of months that is also flawed is shocking. I think the other thing that's really interesting here is, again, process, right? GAVI has congressionally appropriated funds through 2030 and not through Health and Human Services. It's funded through the State Department. But apparently, we don't care about processes anymore. And this is just what happens. So we'll see who steps up. I think maybe some good news or a silver lining in this was the Gates Foundation said that they were going to be stepping up and providing over $1 billion for GAVI. I think that's a really good use of philanthropic funds and within the mission of the Gates Foundation. But man, it is going to ripple.
I just want to highlight that this is all happening within the week in which our country spent literally like hundreds of millions of dollars on a mission to drop bombs in a middle income country. Each of the missiles that get dropped is $3.5 million. So ask yourself, would you rather your government be invested in vaccinating children against disease abroad or dropping bombs abroad, right? Because we're making those choices and we're making them in ways that are not consistent with our public policy, to your point, right? This is about congressionally mandated distribution of funds versus an administration that is trying to pull them and also running roughshod over the constitutional process when it comes to making war, right? So we really have to understand that we have an impact on the rest of the world. We can either save people's children or be on the wrong side of dropping bombs on other people's children. And that really is the choice. America Dissected is brought to you by Boll and Branch. Look, I love the summer, the warm weather, the incredible opportunities to enjoy the outdoors, the long summer nights. But there's one thing I just do not love about the summer. That's sweating those long summer nights in my sheets at night. I sleep hot, and I can't stand that feeling of having the sheets stick to me. And unfortunately, that happens, every summer. Or at least it used to, ever since I've gotten my Boll and Branch Percol sheets. I haven't had to worry about it. See, that's because they're made with a special cooling weave and the finest 100% organic cotton. These sheets feel crisp to the touch, breathable to sleep in, and offer cool comfort that lasts all night, even for the sweatiest of the sleepers, like me. Now you can feel the difference cool comfort can make with Boll and Branch's 30-night guarantee. And I know you'll keep them, because you can feel the difference immediately. You'll sleep cool, even in the hottest weather. That's what we've experienced ever since making the switch. And what's even more impressive is that these sheets get better with every wash, getting softer with time. Feel the difference an extraordinary night's sleep can make with Boll and Branch. Get 15% off plus free shipping on your first set of sheets at bollandbranch.com/AD. That's Boll and Branch, BOLLAND, branch.com/AD to save 15% off. Exclusions apply. See site for details.
All right, so staying on the RFK beat, which seems to be never ending, he just announced that the country's leading health insurers have agreed to improve how prior authorizations are done. Abdul, can you give us the lowdown on prior authorizations and what he's actually doing and maybe not doing through his claims?
Yeah, so if you've ever had to get anything but primary care, you know that you go to a doctor, the doctor refers you usually to a specialist, you see the specialist, but before the specialist can do the thing that the specialist needs to do, they need to get what's called a prior authorization. And what that basically means is that they refer it to the insurance company. So the doctor who saw you has to refer to the insurance company to ask them whether or not they think that the procedure or the medication that they recommend you get is actually medically necessary per some set of physicians, or worse, and I'll get to that in a second, who never actually saw you. And increasingly now, prior authorization is actually being done via AI. And so you've got literally a bureaucracy who you paid money to provide you health insurance, gatekeeping whether or not a doctor who you just saw can give you the health care that they think you need. That prior authorization process is a big, big problem because what happens is people who need health care get denied prior authorization. The physician or care provider who's in front of them saying, I really think this patient needs this treatment, has to wait. And we all know with diseases, it's not like the disease is like, okay, wait. I'm going to wait until they all figure out the bureaucratic process before I get any worse, because that doesn't happen. And so literally this process, it's one of the big reasons why people either fall into medical debt or worse, they delay care that they absolutely need. And so you do need action on prior auth, particularly the way that AI is now being weaponized against real physicians who actually see patients in front of them and their decisions about what kind of care they want to provide. But this approach, right, it's like naming a problem, but then allowing folks to figure it out for themselves. The reason health insurers don't actually want to figure out prior authorization is because it saves them money. The whole point is they want to take your money and not pay it out for healthcare, right? They call that medical loss. And this process, right, of asking the insurers to take a pledge as if this is a real solution to the problem is exactly why we never actually have action against the issues that are causing people to have to go without the healthcare they need or end up in medical debt because they got that healthcare. This is a non-solution solution, but it's entirely in keeping with what RFK Jr. does, which is to name a problem, pretend to solve it, and usually make it worse because all this does is delay any real action.
Yeah, I mean, you're right. We need federal action. I mean, like we can't just pinky promise these things, right? That means rules. It means we need accountability. It means we need consequences. We're just stuck hoping the fox will voluntarily guard the hen house better, and that's just not going to happen right now.
No, and it's so frustrating, right? Because they're trying to take credit for literally not solving a problem. Right? Yeah. Like they name the problem, they know the problem exists. And then the other part of it is there's also an agreement on the back end. Don't forget, like this whole administration operates in this way where they're constantly trying to curry or drive favor with massive corporations, right? You think about the tariff policy. Now you're thinking about this policy. So what is the deal on the back end that says, yeah, we're not actually going to regulate you. We're not actually going to do anything. So what's been done, what's been given on the back end? And that's what I'd like to understand, right? Because if there's nothing, fine. But like, it's awfully frustrating to me to know that you understand that there's a problem that exists and that you're unwilling to actually do anything about it. So you make a show out of pretending to do something about it. So who benefits? And in the end, this is an administration that's shown that it has no shame to make sure that there was some quo for the quid. And that's what I want to understand.
Yeah, it's totally performative. And who benefits? It's politicians, and they know that. I mean, this is not for physicians or patients or whatever. So it's exhausting.
So we have a piece of good news this month that came from the courts. One piece of good news. A federal judge has ordered the Trump administration to reinstate hundreds of NIH grants. So how big of a win is this, Katelyn?
You know, we'll see, right? So the U.S. District Court of Massachusetts basically ruled that the current administration's decision to terminate NIH grants, which, you know, are our scientific discovery engine, based on political objections to research, was basically unlawful. And I do think this is a really important first step in holding the agency accountable, right? The judicial system is responding, thankfully. But I don't think it's the end of the story, right? This ruling actually only applies to the scientists and the states named in the lawsuit, which is only 16 states. And the administration should certainly still appeal the decision and or even just ignore the ruling. So I guess we'll see what happens. I am taking it as a win for now because we need wins, we need hope, but I'm not celebrating in full yet. There's still 5,500 research projects that have been canceled or stopped in only a short amount of months, and it's still completely detrimental to scientific discovery for the world.
Yeah, well, we got to take the wins where we can get them because there are, unfortunately, lots and lots of losses.
Yeah, a lot of losses. And I believe you've got more legal news in the second half of the show. Is that right, Abdul? Given that June is Supreme Court season and some rulings have already come down the pipeline.
Yeah, it's been rough. I had a great conversation with Leah Litman. She's, of course, a University of Michigan law professor and one of the hosts of Strict Scrutiny, a critical show about the Supreme Court. And she's also the author of the book Lawless, How the Supreme Court Runs on Conservative Grievance, Fringe Theories, and Bad Vibes. She joined me to talk just before a couple of these rulings had dropped. And so you'll note that our conversation feels a little bit out of step, but she does offer some really important context for what some of the rulings that have come down since have meant. And I'll tell you that it's not great news, but it is helpful to understand where we go from here. And that's one of the things I really appreciated about our conversation with Leah. So I hope you'll stick around for the conversation. And friends, we're dark again, celebrating the 4th of July. So we'll be back with a brand new episode on July 10th. Katelyn, until then, I hope that you get to celebrate America's birthday in good style, because God hope the next year is better than this last one has been.
Absolutely. You too. Stay cool over there.
We'll do our best. All right. Can you introduce yourself for the tape?
I'm Leah Litman, professor of law at the University of Michigan and author of the recent New York Times bestseller, Lawless, How the Supreme Court Runs on Conservative Grievance, Fringe Theories, and Bad Vibes, and co-host of Strict Scrutiny.
Which is an incredible read, by the way, and thank you for writing it. And of course, Strict Scrutiny, if folks aren't listening, it's one of those must-listens if you want to understand the Supreme Court, both in terms of structure and in terms of vibes. So I really appreciate you making the time. And of course, we always ask folks to introduce yourself, but I feel like this is like an annual thing now, Leah. And given that we're both Ann Arborites here, I'm grateful to have you on again.
Glad to be here.
So, of course, it is Supreme Court season, which over the last several years has been a source of much consternation and sadness for all of us who believe in justice and the American way. And yet, here we are, because we've got a number of cases up before the court that touch on a lot of the issues that are the substrate and of the conversations that we have on our podcast. Let's start with the one that's been ruled upon. And of course, we're taking this conversation on Wednesday, June 25th. So the court has yet to rule on some of the most important cases. But one of the ones that it has ruled on is the Skrmetti case, in which the Supreme Court ruled 6-3 to uphold a Tennessee law banning gender-affirming care for minors. We know that the conservative majority was leaning this way. If you listen to any of the any of the arguments ahead, but this is one that that also has pretty devastating consequences. Can you give us a sense of what kind of precedent this might set, and how this might architect toward different kinds of decisions or cases that we might see before the court?
Yes. So I think the bottom line is this really legitimizes forms of sex discrimination and gender identity discrimination by insisting it's not actually sex discrimination or gender identity discrimination. And so the concern is this really opens up avenues for states to restrict medical care that does discriminate and disproportionately burden women, and that does discriminate and disproportionately burden the trans community. So the Tennessee law at issue in this case actually references sex 19 times. It says the entire purpose of the law is to make people appreciate their sex and to restrict medical care that is inconsistent with an individual's, biological sex is the term that they use. And the Supreme Court insisted that the law did not discriminate on the basis of sex. And it suggested one reason why it didn't is because it was in the field of medicine and it concerned a medical procedure. But the fact that the law regulates medicine, of course, does not mean it doesn't discriminate on the basis of sex. And the concern is that the Supreme Court is basically saying, well, in the medical field, if a state can point to some plausible distinction rooted in biology, well, maybe the Supreme Court is now going to allow some amount of sex discrimination in that area. I think in some ways the court's rationale as to why it didn't discriminate on the basis of gender identity is even more outlandish. So there, the Supreme Court said, well, sure, the group that is negatively affected by this law is just trans minors who can no longer get hormones and puberty blockers for treatment for gender dysphoria. But we're still going to say the law doesn't discriminate on the basis of gender identity because both cis and trans kids can still access hormones and puberty blockers for other reasons, like congenital defects. But that rationale is just super weird, as Justice Sotomayor indicated in her dissent. So again, the concern is the Supreme Court basically pretended discrimination wasn't actually discrimination and thereby potentially invited more of it.
And it's, one of the key points here is just a lot of these medications are available, right? And it's not like the court wants to go after the medications themselves. So the only reason why you wouldn't be able to access these medications is foundational to gender identity. And yet the court is arguing that this is not actually the basis for discrimination. And so it's like a paradox of legal reasoning that it's like refers back on itself over and over and over again into oblivion. It's like the death of one of these stars is it just like compacts into its own gravity.
Yeah, no, like the Death Star, or it's like it's turtles all the way down, right? Because like, as you're saying, these hormones and puberty blockers, they're not prohibited. You can still access the exact same medication just to treat other things. And I think that underscores these aren't dangerous medications. And it also reveals the only thing the state is targeting is treatment for gender dysphoria, which, as you say, is inextricably linked with gender identity and what it means to be transgender.
Yeah. It's, in part of the context I want folks to understand here is, there is a broader set of norms around liberty that is being attacked here. And then, we're just a couple of days from 3 years away from the disastrous decision in Dobbs that puts people in robes or people elected to legislatures in positions to decide when and how you can get care. And it's essentially anti-conservative, right? In the sense that conservative ideology is based on the notion that you should be able to make a decision at the lowest possible point of decision making, meaning you should be able to have access to the things that your doctor thinks you should have. But this is about one size fits all policy around very specific circumstances in which you cannot access a medication. And anybody who believes in like basic liberties should be very worried about the implications that this sets up.
Yes. And so you mentioned Dobbs, and actually the decision in Skrmetti relies on the same archaic sex discrimination case that Dobbs revived, this old 1970s case, Geduldig, that said when legislatures discriminate on the basis of pregnancy, when they discriminate against pregnant people, that isn't sex discrimination. So that's the line of thinking that the Republican justices are reviving. And it's really like a MAHA, Make America Healthy Again vibe, throughout this entire opinion, as well as the concurrences where you had Clarence Thomas mocking the self-proclaimed experts on gender dysphoria and gender identity before he launches into his own treatise and his own views about gender identity and gender dysphoria, as if he knows better than the doctors.
Yeah, it's it's fascinating, right? Because ostensibly the only reason you get to serve on the Supreme Court is because you are an expert in the law. And then to see somebody who is an ostensible expert in the law mock other forms of expertise and then wax philosophical about the things on which they are not expert. Again, it's like one of these sort of enigmas wrapped in a paradox.
Right.
So one of the other cases that's really important from the health standpoint is yet another challenge, who saw it coming, to the Affordable Care Act. And one of the things that the Affordable Care Act does is that it requires health insurers to cover preventive care at no cost, things like mammograms and colonoscopies. And what it does is it appoints a task force of about 16 people who decide which services are supposed to be covered. And then the case goes after the fact that because these 16 people are appointed by the HHS secretary and not confirmed by the Senate, that somehow this is unconstitutional, which is, of course, just based on principle, because let's be clear, those preventive services benefit both the insurers and the individuals receiving those services. So what would it mean if, in fact, this was found to be unconstitutional? What would it mean for access to preventive care? What would it mean for the Affordable Care Act writ large?
So when you say it's based on principle, this is a case brought by an employer who objected to having to provide health insurance coverage for both PrEP, pre-exposure prophylaxis drugs, as well as contraception, on the ground that this facilitated, choices, lifestyles with which the employer disagreed. So that's who's bringing this case. And it really would, I think, completely disarm and render totally useless the Preventative Services Task Force, because if these members of the task force were not constitutionally appointed, then that would mean all of their designations of which kinds of healthcare insurers have to cover are void. So they can't require insurers to cover any kinds of care unless and until the Senate confirms members of the Preventative Services Task Force, given how the Senate is operating, in part because the Senate confirmed RFK Jr. to be Secretary of Health and Human Services. That doesn't bode particularly well for the future of the Preventative Services Task Force.
Yeah, that is a really dire thing to think through. And also, it's just so completely self-defeating. You'd imagine under a different administration, you could just have the HHS secretary, who is Senate confirmed, directly make the recommendations, and that way you would bypass this entire situation. But given where we are in this administration, it is a well-timed attack that is intent on trying to dismantle as much of the ACA as possible. And just again, let's just think through this. These are services that benefit the people who receive them and the people who provide them. Because of course, if you can prevent a case of HIV, you don't have to treat a case of HIV. If you can prevent a pregnancy that's unwanted, you don't have to pay for pregnancy services and delivery. All of this is just about trying to attack on principle. And it is just so deeply frustrating to watch our government attack itself and the things that it's actually gotten right that benefit people out in the community.
It's also entirely cockamamie theory, because the idea that the members of the Preventative Services Task Force are officers that have to be appointed, these are part-time volunteer individuals who have full-time jobs elsewhere. These are not officers of the United States on the same level as the Secretary of Defense, who has to be presidentially nominated and Senate confirmed. It's just silly.
That is wild. And, again, it's like, you have to give them credit for trying to find the thinnest possible read of an argument, and then trying to overblow it as much as possible. And I do hope that folks who want government to actually do good things for people are taking notes, right? Because too often, I think, approaches to a more broad-shouldered, muscular government intervention to provide people basic things like healthcare, we argue with ourselves before we actually try to make the argument, and then we become self-defeating in our own ways. And so I do hope that a lot of us are taking notes here, because if they're willing to try and take out the ACA and access to preventive services like this, then I just think that there's a lot of space here to be saying, well, look, if you want to stretch public policy in this way, like let's just make sure we're leveraging what's available to make the best possible case to provide people good things in their lives. There's another case, and you've got Planned Parenthood, which of course, if you think about where the MAGA movement is going to try and attack, it's Planned Parenthood, and it involves Medicaid. Medicaid is a federally funded program that's operated through the states with certain provisos and rules. And one such rule is that they have to allow Medicaid recipients to get treatment from any, quote, any qualified and willing provider. But several years ago, South Carolina's governor issued an executive order that banned Planned Parenthood from participating in their state's Medicaid program. So Planned Parenthood sued, and the justices are now asked to decide whether that action denied patients the full selection of doctors that they're entitled to. And in earlier hearings, did we get any clues about how the justices are going to lean? And before you answer that question, I just want to be clear about something. This is about the bulk of the work that Planned Parenthood does. Oftentimes when we think about Planned Parenthood, we think about it as an abortion services provider. But Planned Parenthood is one of the most important providers of women's health care in many of the communities in which it sits. And so you're talking about other services. You think about like STI screening and treatment, for example, that gets provided through Planned Parenthood. And so they're targeting Planned Parenthood simply because it's also an abortion service provider and trying to take it off of the Medicaid formulary here. And so do we have a sense of where the justices might go?
It's always a little bit tricky to try to divine clues from an oral argument because sometimes the justices will be playing devil's advocate or trying to test both sides. I did not come away from the oral argument thinking it was very clear that there was a majority to reject the argument that these patients and providers couldn't sue to challenge a state's decision to exclude Planned Parenthood from the Medicaid program. It seemed like maybe there could be a majority of Republican justices who would say the patients and providers can't sue to challenge. So basically, there is no remedy, nothing you can do if a state unlawfully excludes Planned Parenthood from the Medicaid program. So that's my guess about where the case is going. But again, not super confident in that because, you never know when they're kind of play acting an oral argument.
Yeah. What might be the fallout if the court were to rule with plaintiffs or against plaintiffs?
If they rule against the plaintiffs and say patients and providers cannot sue to challenge a state's exclusion of Planned Parenthood from Medicaid, that is going to be devastating for healthcare access. In many places in the country, I think particularly rural areas where Planned Parenthood might be the only healthcare provider offering reproductive health care within, pretty large geographic areas. And if a state refuses to reimburse care that people obtain at Planned Parenthood, it is going to be condemning, the women who only live close to a Planned Parenthood not to be able to receive any sort of reimbursable care, potentially within hours of where they live. Given the state of maternal health care in the United States, given the state of reproductive health care in the United States, that is just, a travesty to do, at any time, particularly now.
I hear you on that. And that's the thing about it is that people don't realize that Planned Parenthood does a lot more than reproductive services. And also they do reproductive services, which are critically important in the communities in which they operate. And so this has been part and parcel of a focus on taking out the organization as it stands. And what that ends up doing is robbing people of access to critical healthcare in communities where there are not other alternatives. And I was just in a community where they had lost their single Planned Parenthood clinic, and the wait time to get services that Planned Parenthood provides, not just reproductive services in a state where access to an abortion remains legal, but also just to get the healthcare that people were relying on Planned Parenthood to get. That has been a real challenge for those folks. And, you gotta wait in line for a long time. And, anybody who knows anything about reproductive services knows that time is of the essence. There's not a long time in which you can sort of sit and wait for the care that you need. And so this is devastating for a lot of people.
Yes. And, when you say reproductive health care, we're also talking about pap smears. being able to test people for cervical cancer and identify it at an early stage, or give people the HPV vaccine that would prevent them from getting cervical cancer. And so denying people that care and making it so difficult for them to obtain testing to do early detection, or again, different forms of preventative care, is just cruel.
Yeah. Yeah. And deadly, right?
Yes.
Like, there are people who otherwise will not get the care that they need, who will not get a early cancer diagnosis that could render that cancer from being easily treatable to being deadly. And, it's one of the things in healthcare that I find deeply frustrating is the fact that we consistently abstract away into numbers. And I'm an epidemiologist, so literally my entire discipline has been about doing this thing. But you cannot forget the people underneath the numbers you're talking about. And there's this way that numbers dehumanize the tragedies underneath each of them. And so, when Republicans do this, right, they tend to rely on a certain set of numbers to explain away the consequences of what they're doing. But there are people out there who, as a function of a choice that the justices are going to make, are going to have their lives turned upside down. And we cannot forget those people, right? Because they sit downstream of a process that's intended specifically to take out a set of healthcare organizations and facilities simply as a function of providing a level of healthcare that they actively deem to be wrong and they want to discriminate against. And that's a foundational problem in society, that this is a thing that is getting done consistently. And by the way, it does not get done in other places in the world. I want us to just put an exclamation point on and think about that for a minute.
Yeah.
On to one last case. And I know this is a very dour conversation, but I feel like aren't all of ours these days.
It's about the Supreme Court. They're the problem, not us.
That's true. That's fair. And the Trump administration more generally.
Yes.
But this one is on birthright citizenship. Okay. And I want to bring this up because, it seems somewhat alien to the conversations that we usually have, but it has really, really important health implications, right? Because, in some respects, your ability to belong to the place that you live in is foundational to your ability to get services in that place. And if they uproot the foundations of citizenship, that is going to dislocate a lot of people, and it's going to change access to a number of important services that people felt like they could rely on. Now, I want to ask you, how should we be thinking about the birthright citizenship case? I think a lot of us, when it initially came up, kind of laughed it off. But I want to understand from your perspective, how seriously should we be thinking about this?
We should absolutely be thinking about this because technically the case isn't really about birthright citizenship. It is about federal courts' power to block a policy on a nationwide basis. And if you think about any case where federal courts should have the power to block a policy on a nationwide basis, you would think it would be a citizenship immigration case like birthright citizenship, because how is it even going to work if you don't have federal courts block this policy on a nationwide basis? Are you going to have babies born in Michigan go to Texas and be denied citizenship or access to services? Are you going to have babies born in Texas being denied citizenship and then they travel elsewhere? Are you going to be forcing parents to go to states where the birthright citizenship order isn't in effect? What exactly is that world going to look like? The Constitution requires there to be a uniform rule of citizenship. It guarantees birthright citizenship. And the idea that you would prevent or make it more difficult for federal courts to block a wildly illegal policy that is going to cause grave harm on a nationwide basis, I think should shock people. Now, I don't think actually the Supreme Court is going to completely prohibit what are called nationwide injunctions in this case, but the question is going to be, how much are they going to restrict them? Are they going to say a nationwide injunction is definitely warranted in this case? Are they going to say anything to reaffirm the importance and centrality of birthright citizenship to our constitutional order? I think we should hope that they do so, but I will be watching.
Yeah, Leah, to your point, right? This is sort of a chip shot, right?
Yeah.
I think for all of us watching, obviously the highlight of the case and the title is about birthright citizenship. But what they're trying to do is leverage this case to take out a foundational procedure in the way that judges and our judicial system operates. And they're trying to almost regionalize the ability of a district judge to issue an injunction, which is a piece of precedent that can then get applied in a number of different spaces that have nothing to do with citizenship. And it's that precedent that I think, it's sort of wild to even try and wrap your mind around, because so much of what's protected people in this moment in this country from the worst excesses of this administration is exactly that capacity for any judge to issue a nationwide injunction. And can you sort of give us a sort of example of where this might go next? Like if they were to come out and say, look, well, obviously the Constitution is clear on birthright citizenship, but this nationwide injunction question is one that we find questionable. Where could the administration flex their muscles next?
So I want to play out how the administration thinks this would work in the event the Supreme Court limits lower courts' ability to issue nationwide injunctions in this case. So the administration's position is they actually don't have to apply a decision of a court of appeals or a district court to other people in that jurisdiction if there is no form of nationwide relief. So let me just get more specific. Let's imagine that the Supreme Court limits nationwide injunctions and the administration therefore tries to implement their policy. And then let's imagine that one U.S. citizen baby argues in court, this order is illegal, and they get a decision of a district judge in Texas saying, you're right, the order is illegal and you're a citizen. The administration's position is they can still continue to deny birthright citizenship to other babies that didn't sue if there isn't a nationwide injunction or class action. That is, as Justice Ketanji Brown Jackson said at oral argument, a catch me if you can regime when it comes to the executive branch and the law, because you're allowing the executive branch to get away with legal violations if absolutely everyone under the sun doesn't sue them to vindicate their rights.
What would it mean for like a class or trying to bring like a class action in that respect? Could that still be possible?
So it could be, but the administration before the Supreme Court was unwilling to agree to the possibility that a class action would be appropriate. Instead, they argued a class action wouldn't be appropriate because there are different categories of individuals, people who are born to mothers who are temporarily but lawfully here, people who are born to mothers who are not lawfully here, and so on. And so they suggested you can't have a class action that would protect absolutely everyone subject to this illegal order.
And I would imagine from the way we think about interpreting the Constitution, that would in effect mean that the only court that could interpret a law as unconstitutional would be the Supreme Court, right?
Exactly.
So now you're talking about like a year and a half of time before you get any,
if not more.
Yeah, that's wild. I mean, and this is the thing about it, right? It's like for folks who don't spend as much time thinking through the legal implications of these decision sets, when you hear a lot of us talk about the move toward authoritarianism, these are the processes by which that happens. So it's basically saying that for like 2 years, a president can get away with whatever it is that they want through executive order because you actually don't have recourse to the law until a case works its way all the way up to the Supreme Court. And then you got to imagine, right? Like we don't have a big enough judiciary to actually take on all of the individual cases of people who are trying to sue over one issue, right? So like if every single person affected by a decision around birthright citizenship has to sue for their own rights, like you immediately flood the courts. And when you immediately flood the courts, that basically means that unless you're the first to the court, exactly, nobody actually gets to have their case heard in a court of law. And like if this is not an attempt to leverage bureaucracy against the basic functioning of the rule of law, I really don't know what is.
Yep.
Well, on that note, Leah, give us something to look forward to. Give us something happy, like something something that might make us feel like we still live in a democracy with the rule of law, where the Constitution functions to govern the people who swore an oath to it.
You are really putting me on the spot. If I had to, identify, this is a complicated example, but what I would say is the administration returned Kilmar Abrego Garcia to the United States after he was wrongfully expelled to El Salvador. Admittedly, it did so kicking and dragging its feet, and is now subjecting him to some very dubious, questionable criminal legal charges. But they were forced to do that through a combination of political pushback, public organization and protest, media coverage, and courts of law. So if you are looking for evidence that protest, pushback, organizing, and advocacy works, I think that is one such case. The courts are not going to do their job in the absence of public organization and protest. And so, again, these decisions, the ones we are expecting and talking about, are not likely going to end well, but that doesn't mean we are powerless to do nothing.
That is a hopeful place to end it, because I think it's really important for us to remember that the choices we make in our democracy matter. I think we sometimes take for granted that democracy is like bolted down with nuts and bolts. It's not. It's like a ship in a bottle, and if you shake the bottle enough, the ship breaks down. And the truth of the matter is that we have to show up to enforce the norms and mores of our democratic process, and insist upon the notion that it functions and that our elected officials respect those norms and mores. And so I really appreciate you, Leah, for taking the time to walk us through some of these cases. Again, we're taping on Wednesday, June 25th, so we may very well have some of those decisions by the time that this airs. But we appreciate you helping us make some sense out of it. Again, our guest today is Leah Litman. She is a professor of law at the University of Michigan. She's also the author of Lawless: How the Supreme Court Runs on Conservative Grievance, Fringe Theories, and Bad Vibes, and a co-host of Strict Scrutiny. Drops every Monday. I highly recommend. Leah, thank you so much for the time.
Thanks so much for having me.
That's it for today. You can find more content at our website, incisionmedia.co. Check out our shop at store.americadissected.com for our new America Dissected merch, including logo shirts, hoodies, and mugs. And don't miss our Vaccines Matter, Science Works t-shirts, and our Make America Scientific Again hats. If you have guest recommendations for the show, send us an email at info@incisionmedia.co. You can follow or subscribe to America Dissected on your favorite podcast platform and on YouTube at America Dissected. You can follow me on Instagram, TikTok, and Twitter at Abdul that's no dash. And make sure to subscribe to Katelyn's incredible newsletter, Your Local Epidemiologist, which breaks down the latest scientific evidence for over 300,000 readers. Search for Your Local Epidemiologist on Substack. Links to our sponsors, as always, are available in the show notes. I really do hope you'll check them out and show them some love. They do make the show possible every single week. Finally, on your way out, don't forget to leave us a 5-star review. And if you're watching on YouTube, make sure to drop a like or a comment. Word of mouth still goes a long way, even in this internet era. So if you know someone who might like to keep up with everything that's happening in the world of health, do let them know. America Dissected is a product of Incision Media. Our co-host is Dr. Katelyn Jetelina. Our producer is Andy Gardner-Bernstein. Video and audio editing by Nadine Malconian. Our theme song is by Takashi Sazawa and Alex Hudiera. Sales and marketing by Joel Fowler and Nick Freeman at Big Little Media. Our executive producers are Tara Knight and me, Dr. Abdul your host. Thanks for listening. This show is for general information and entertainment purposes only. It's not intended to provide specific healthcare or medical advice and should not be construed as providing healthcare or medical advice. Please consult your own physician with any questions related to your own health.